dermapen treatment device. And you're going to open the sealed package on your tip. And you're going to insert down into the top here and turn until it's secure and in place. Then you're going to take your sleeve, leaving the backing on, and you're going to slide it down into the device to cover, and this is what's going to protect your device from bloodborne pathogens, bacteria, keep you and your client safe. Kind of tight when you get down to the bottom, so making sure that you push the device all the way through until it pops through so that you have a very good seal up on the top of that device. And then remove your backing. And then you're ready to begin by just removing the cap on the needle. So we'll go ahead and remove the cap and begin our treatment. Okay. So once you are ready to begin, you're going to apply your hyaluronic acid. So we're going to start on the cheek side. So we're going to go ahead and turn her so we can create that flat surface so we can be working upward towards ourselves so we can do that striping mechanism on the treatment. So we've got our hyaluronic acid. We're going ahead and apply that to the client's skin, and remembering not to touch the tip on the client's skin for cross-contamination. So just a few droplets, not a lot of the product has to be used, just to give you some slip and glide and help to hydrate and moisturize the skin as we're doing the treatment. Okay, we've removed our cap, and then we're going to go ahead and set our needle depth. We're going to be on the cheek area where it's fleshier areas, we're going to be at a 1. So you're going to go ahead and set the depth there, and then your speed here up at the top, we're going to be on a 3. I'm going to go ahead and set the top that our speed is a 3. Okay, so once we have that set, we're going to go ahead and begin the treatment. I'm going to start in that fashion of just the striping. I'm going to start vertically and just bringing the device up and across the skin. I like to work in little sections where you take that cheek area, work in a section, and do your cross-hatching. So you've got your vertical, and then we're going to come back and do our horizontal. Across the face here. So once we've completed that section, we're going to turn our device off. And then we'll move to the next section. Taking a look at the erythema, we're getting some good edema there. We'll massage that product in, so it's nice to massage that hyaluronic acid into the area. And then we'll move over to this section. So we're going to go ahead and just turn our client here. It is recommended 2 to 3 passes. So the first pass, vertical, horizontal, and then if a third pass is needed for areas of concern, wrinkles, at-rest wrinkles, creases in the skin, acne-prone areas that have a lot of acne scarring that we want to really make sure that we're treating well, is when you would want to do that third pass. So again, we're staying at our 1. We're going to come and move upward motion here. Just striping again along the areas. Come back across, and notice how I'm kind of stopping right at that bony area on the eye, because we're going to want to reduce the depth around those areas around the eyes that are a little more sensitive and thinner skin. So I like to go ahead and do all of my treatments with the 1, so the fleshier areas first, and then adjust my settings and come back to those thinner areas. And then we're going to move to the next side. We'll move over to the other cheek and work down in this area. You can see our client has a little bit of sunspots here from photo sun exposure. We can go ahead and stamp those areas to help break up those melanocytes. And this would be also a great client to apply a low-grade percentage of a chemical peel to help lighten and tone those photo-damaged areas of the skin. So again, we are at the 1, and speed is 3. And just doing your striping motion, making sure that you're not snaking the device, going back and forth. No circular motion. This gives you very good coverage, cross-hatching, back and forth. client today doesn't have it, but sometimes your clients may have a little slight wrinkling here on the ear. You want to take and pull that, and you can come in and stamp method here, kind of tone and tighten as we start to lose that elasticity around the ear area. You want that, and then we're also going to just stamp here. So stamping method is just 1, 2, 3, 1, 2, 3, and then I massage that in, and then let's go with one more. Just break up that little sunspot for her, okay? Go ahead and turn our machine off again, and we'll move to that next section. And one thing you'll notice about the new technology of the tip is that it has that edge on it. I don't know if you can see that, the edge on it that helps that smooth and glide to the skin. After using the other tips, I love this new technology. It really helps the slip and glide. You're not clogging with your product. You're using less product during the application. And also if you have a client that has, more kind of ruddier skin to the area, you want to make sure that you're getting full coverage, but keeping that good contact, and this really helps to keep that good contact with the skin and smooth glide treatment. And again, holding that skin taut. The client happens to have more laxity in their skin, making sure that you're really pulling the skin tight. Massaging that back in there, and just seeing that really good erythema and edema to the skin is what our clinical endpoint is. We don't want to have them bleeding and going off the table. Our stamping, you can see we've kind of broken up that pigment a little bit. Let's turn center, and we're going to go ahead and treat the chin area. And it looks like our client has a little bit of a scar here. So we're going to go ahead and we can stamp that because we can help minimize the appearance of scars. Help smooth that out for her. Apply our product there, and what I would do is just pulling that skin taut and making sure you get right in that little line there on that chin as we move forward with the treatment there. And again, I'm going to keep it on a 1, so we've got our treatment there. One thing, as you can notice, you always want to make sure that you're kind of keeping the device. We do have clips that we don't have today, just kind of keeping the cord the best you can out of the client's face and draping it across them, so moving it so that you have clearance of that device. You have to go ahead and put your tongue, and there you go. Have the client really get that open for you so you can get a firm contact on that area. This is where if they have smoker's lines, as we age, we get those lines there that you want to make sure that you're treating those areas for the customer. And we're going to go ahead on top of that scar, and let's just stamping method here right across that area. And then again, massaging that product in. And the post-massaging after each section really helps the client too. You've got a little bit of stinging, after the treatment and some heat in there. It really makes the treatment a little more comfortable for them. Now we're going to go to the upper lip, and then we'll move into the nose and eyes and forehead, and that's when we'll adjust our treatment depths here. So let's move on really quickly just to the upper lip. Getting our product there. And again, I'm going to have you put your tongue up over the top of your teeth and elongate. I'm on a 2. I'm going to go a little bit slower. Really sensitive on that upper lip area. Kind of working in that downward motion. And then I'm going to come back across, just right over that bow. You can go on top of the lips if the client would like to, but again, making sure your depths are very minimal. And you can come right into that vermilion border, just right on the edges. Get on those sides where we tend to get that wrinkling here. Okay, you can relax now. Okay, and now you can see we're going to massage that in. come back in and our client's starting to get, she smiles too much, right? Just a little bit of in those nasolabial folds. We're just going to stamp right here, and that third pass in that area, just stamping along there, will help build that collagen and elastin up here, where a lot of clients get injections, but this can actually really help build their own collagen and elastin to help minimize those signs of aging with the wrinkling around the mouth area. So I'm going to just come in and we're going to stripe down with a little bit of our hyaluronic acid. I'm going to keep it on a 2 of our speed and the 1 of our depth. And we're going to go ahead and just come right in where they tend to get those lines, and we're just going to stamp right down those edges, and this will just help to build that collagen and elastin in those lines. Massage that back in. Okay, good. Okay. Now we're going to move to the areas of the face that are a little thinner skin and bonier. So we're going to adjust our depth on our device. We're going to go to 0.5 and we'll do forehead and the temples here, and then we'll lower again to 0.25. And we're going to come right up in here on the eyes and the brow area to give them a little brow lift. So we're going to move to the nose and temples and the forehead next. And again, we're going to adjust our depth down here on our device. And sometimes it's kind of hard to see through the device, so I like to feel there's like a little knob here that you can feel where you're locking your device into place. Also. So we have reset our depth really fast, really quick, not having to change a whole lot. So we're going to start with right here on the temples, and then we'll move forward with the forehead. Okay. You can kind of see our section of erythema where we've left off, so we're just going to start there and kind of match up our sections as we move forward. Remembering to always keep your device at that 90-degree angle, flush and perpendicular to the skin. And massage that in once we are done there. And we'll move over to the next side of the treatment area, which will be the temple here. Apply a little bit of our hyaluronic acid. And again, matching up where our erythema, and we know where we've treated. And the great thing about this device is that you don't have to worry about it removing hair, so you can get right up into that hairline, where IPLs and other devices were a little concerned about getting close to the hairline, so we can kind of go right into that hairline and help pull those, build that collagen and elastin, and that's where we want that to help pull up. Now we're going to go ahead with the forehead. So we'll apply the product here. The forehead's kind of thin, bonier areas, a little more painful for customers, so I like to do that kind of last, just a personal preference. But just taking and working in a systematic fashion when you're doing your treatments, little areas, not bouncing around during the treatment, but kind of keep a good flow to your treatment. I'm going to do my vertical striping first, and then we'll come back and do our horizontal. And as you can see, this tip glides really well over the top of the forehead when you have those bonier contours of the face. Thinner people tend to have, a little bonier foreheads. We're coming back across. So I go vertical all the way across the forehead, and then split it in half and come back around and do your horizontal. Just making sure that you're matching up and following. I like to see the imprint in my hyaluronic acid, that I'm kind of going across the skin and getting good contact. and coverage of the device. And again, we're just going to massage that in there. Okay. The next section we'll move to